Welcome to RWJBarnabas Health's Health Talk Show. I am Dr. Douglas Oshinsky of RWJBarnabas Health Medical Group. Women have a higher risk of developing certain serious health conditions such as breast cancer, osteoporosis, and gynecologic cancer. Many of these conditions can be prevented or managed if the warning signs are found early enough. On today's show, we will learn more about breast and gynecologic cancers, symptoms, treatment options, and prevention methods. We are pleased to welcome Dr. Ruth Stevenson, a gynecologic oncologist. Dr. Stevenson is a member of RWJBarnabas Health Medical Group and sees patients at RWJUH, Somerset, and Rutgers Cancer Institute. We also welcome Dr. Deborah Liu, Medical Director of Breast Services at RWJUH, Somerset's Steeplechase Cancer Center. Dr. Liu is also a member of RWJBarnabas Health Medical Group. Welcome to the show. Thank you both for being here on this show. First, for the audience, they'd like to know a little bit about your background. We'll start with Dr. Ruth Stevenson. Tell us a little bit about yourself and where you're currently located and treating patients.
So I'm Ruth Stevenson. I'm a GYN oncologist. I'm through RWJ Medical School and the Cancer Institute. I take care of patients at Somerset Hospital as well as in New Brunswick. GYN oncologists are specialists who are trained in the surgical and non-surgical treatment and management of gynecologic malignancies. We're a unique surgical oncology field in that we perform surgery and administer and direct systemic therapy such as chemotherapy in clinical trials.
Thank you. And Dr. Deborah Liu, we've seen you in the past. Again, just a background on yourself.
I've been doing breast surgical oncology for almost 25 years right now. I am based at Robert Wood Johnson Somerset at the Steeplechase Cancer Center. I do focus on breast surgery, which includes both cancer and non-cancer diseases of the breast. We have a very full service breast running, and I am the breast program director.
Thank you both. And again, thank you both for being here. So let's talk about the different types of gynecologic cancers. Dr. Stevenson, can you give us, the different types that we do see and examples of warning signs and symptoms?
So gynecologic cancers arise from the female pelvic organs. These include ovarian cancer, uterine cancer, cervical cancer, rare cancers of the vagina and the vulva. We also manage abnormal pregnancies and other complex GYN conditions. Warning signs can be vague or very apparent, but they can be subtle. Things like abdominal bloating, change in bowel or bladder habits, abnormal periods, losing weight. All of these should be evaluated by a physician immediately.
This is something very important, that any changes in anything within the lower abdominal area for a woman to discuss either with their primary care physician or their OBGYN in order to assess whether they need any further evaluation.
Correct, yes.
And those evaluations would be?
So things like ultrasounds, pelvic exams, pap smears, biopsies, these can all be performed by an OBGYN to help determine if there's a malignant or pre-malignant condition. Once they're seen by their general OBGYN, they can be referred to an oncologic specialist depending on what they find. Often I see patients that, something just doesn't feel right in the abdomen and they end up seeing a gastroenterologist or a urologist. So it's always important to undergo a gynecologic exam and follow up if you have any sort of abdominal or pelvic symptoms.
And does age impact?
Yes, age is one of the biggest risk factors for gynecologic malignancy. And I found that, women, after they're done having babies, they stop seeing an OBGYN for routine screening and pelvic exams. So I encourage all women, no matter where they are in their GYN history, to be seen by a gynecologist annually.
So again, the important things to remember are First, it's very hard to determine etiologies immediately. That if
Correct.
there are changes, make sure you contact your primary care physician or your OBGYN. They may refer you either to a GI if they think it's GI. They may do specific types of testing, and then based on that, may eventually figure out what's going on. At that point, whether it's benign or not benign, if there's a gynecologic cancer, it's important to get that woman over to a gynecologic oncologist who understands what could possibly, all of the different things that can be done.
Correct.
And unfortunately, in our area of the New Jersey, there aren't many gynecologic oncologists such as yourself. And so it's important that they get to understand that when there's a problem, RWJBarnabas is a place to be referred to.
Correct.
Now, can you recommend preventive methods for individuals to minimize their risks?
Yeah, so prevention, one of the biggest things that we have now is the HPV vaccine. So I encourage all young women and men to get the vaccine because cervical cancer can be a preventable disease if we increase our vaccination rates, things like pap smears, annual pelvic exams with your gynecologist, and certainly looking out for worrisome symptoms. There's certain high-risk individuals that need to undergo more intensive screening. If you have a family history of gynecologic malignancy, then you may need to be seen more frequently for pelvic ultrasounds, exams, and blood work. These are all preventative measures, as well as maintaining a healthy diet, lifestyle, listening to your body, being seen if something is off. Those are all things that can prevent gynecologic malignancies or detect them early.
I was just going to ask, is there an optimal time to get that vaccine?
Yes. So right now for women, it's recommended between the ages of 11 and 45. And for boys, I have two sons, it's 11 to 25. But there's actually increasing evidence that the vaccine can also be therapeutic. So I'm offering it to all women, regardless of their age, based on their history.
So again, important things to remember. One, HPV vaccine, something that's important, can reduce the risk of gynecologic problems down the road. Not only gynecologic, but also giving it to the male sex also. Number two, seeing their OBGYN and or primary care for routine pelvic exams, pap smears with HPV testing also important. Even after the woman finishes having periods, to continue follow-up evaluations with the OBGYN. Family history importance also, that may be more screening based on the family history. And even after the woman is above the age of 65, even though it's not recommended to have periodic pap smears, to continue to see the gynecologist for the continued physical evaluation of the lower abdominal area.
Correct.
So even though they're no longer having periods, they've gone through everything, they're in the Medicare age, it's important to continue following up with their OBGYNs.
Yes.
Okay. Can you tell us about different treatment options patients have?
Yeah, so surgery is a mainstay for most early stage gynecologic malignancies. We're doing robotic surgery, minimally invasive surgery. We now have data to support sentinel lymph node detection for most early GYN cancers. Chemotherapy, radiation therapy are often given for advanced disease or as an adjuvant therapy, and clinical trials. Some of the new treatment options we have available for gynecologic malignancies are things like targeted agents, immunotherapy, hormonal therapy. So these are all things that we can use to treat the gynecologic malignancy based on the stage and the origin.
And again, since you are part of the Rutgers Cancer Institute, people need to understand that you are giving them state-of-the-art treatment, the possibility, if necessary, clinical trials, which they can get because, again, being part of the Rutgers Cancer Institute.
Yeah, correct. We run all of our own clinical trials for our GYN cancer patients. Our patients have access to cellular therapy through our immunotherapy department. We have a big collaborative team here of not only GYN oncologists, but radiation oncologists, medical oncologists, and clinical trials experts here that can help enroll patients in these clinical trials that are available not only at the Cancer Institute, but also open at multiple sites across the system.
Now we're going to move up a little. Now we're going to move up a little bit. We're going to get Dr. Liu involved with breast cancer. Dr. Liu, who's part of the Steeplechase Cancer Center, also collaborating with the Rutgers Cancer Institute. Can you tell us a little bit first? Tell us about breast cancer and how it's diagnosed, so that women understand about preventive measures.
Yeah, so just piggybacking off of what Dr. Stevenson was saying too, I think it's important for the audience to understand that they can be treated locally, right in their backyard. They don't need to go elsewhere, which makes it easier to go through most therapies. Breast cancer is also diagnosed with a clinical exam, as well as breast imaging, mammogram, and a biopsy, a tissue biopsy. We encourage women to get their with an average risk for cancer to get an annual mammogram starting at age 40. RWJ Somerset offers state-of-the-art imaging, everything from 3D mammograms to breast MRIs to ultrasounds. We have state-of-the-art imaging for diagnosis.
And again, important that women understand prevention is very important. If we catch it early, things can be done. Women live a full life. Same thing with gynecologic cancers. Let's find them early, treat them early if necessary, follow them, and have normal lifespans.
Exactly. They're curable when they're picked up early. And that's why early detection and prevention is so important.
So things to prevent breast cancer.
Oh, well, I could go on all day. No, for their lifestyle, really 5 lifestyle things that we focus on that can reduce a woman's risk for breast cancer by as much as 30%. And the only side effects of these lifestyle modifications is that a woman looks good and she feels good. But essentially, the 5 things are a plant-based diet, regular exercise, weight management, no tobacco, and control of alcohol. I can go into a little bit more detail on some of that. A plant-based diet for us means that 70% of everything a woman puts in her mouth should come from a fruit, vegetable, or grain. No more than 30% from an animal source. And we ask patients to stay away from fatty animal sources like pork, and processed animals like bacon, very rarely, if any, ever those types of animal sources. Focus more on chicken, turkey, fish, the lean animals. Again, 70% from a fruit, vegetable, or grain, 30% from no more than 30% from an animal source. With regard to exercise, we have a prescription that we try to ask patients to get a minimum of 5 30-minute sessions of cardio per week and 2 30-minute sessions of strength training. That is the minimum amount of exercise that we feel a woman needs per week to get any kind of significant risk reduction down the line. And this is not a sprint. This is a marathon. This is about building lifestyle habits so that they are exactly that, habits. They're not something you think about. They're just something built into your routines. With regard to weight, we ask that women keep their body mass index between 18 and 25. That's optimal for risk reduction. No amount of tobacco is safe, and we say up to 3 drinks a week is acceptable alcohol consumption. Anything over that starts to significantly increase your risk for breast cancer. So that's prevention-wise what we ask women to focus on. Of course, the mammogram is screening. The annual mammogram for average risk females over 40 is important, and we're asking women now who are 25 and above to get an annual clinical exam with their either primary care doctor or their gynecologist and have a formal risk reduction done so they can find out whether or not they're actually average risk or high risk, because the average risk woman will wait until about age 40 to get her mammogram. If they're higher risk, they may actually need earlier screening. And the only way to pick up those women is at 25 to get a formal risk assessment and a clinical exam by their primary care or their GYN.
And again, a lot of that can also be done at the Steeplechase Cancer Center, as I do get those reports all the time about the cancer risk that the woman has.
Yeah, we're that's one of the recent changes, that women are getting formal risk assessments now, standard. And we, as a breast surgeon, and as Dr. Stevenson said too, we're not really the gatekeepers for the population. We don't see women just coming in regularly for screening. You will see those patients. So it's important that women know they need to go and see their primary carers and their gynecologists, because they're going to be doing these screening exams and testing.
So, like any other, it's any other subject. To prevent things, try to stay as healthy as possible. Plant-based diet. If you can't understand what a plant-based diet is, it's best to talk to a dietitian or a nutritionist. They can put together a good plant-based diet for you to reduce the red meats, more fish, chicken, adding fruits, vegetables, fiber to the diet, maintaining good blood pressure, good weight, reduction in the use of cigarettes or stopping completely, as RWJ does have a smoking cessation program. If the woman needs it, it's something to think about. And then, of course, importance of seeing their primary or their OBGYN for the necessary preventive testing. And again, as you had said, a woman starting at age 25, seeing the OB for a breast risk assessment to understand whether they need to start formal testing of mammograms, et cetera, earlier than age 40.
Correct. And they also have access to breast MRI as early screening if they fall into that high-risk category. There's new data starting to come down in the literature about the African-American population that might actually have a little bit higher risk and actually maybe need to be screened even a little earlier than 40. But that is, new data that's still just starting to trickle down as we start to do more studies on diverse populations that didn't exist before, some of these studies and some of this data. I think it's important too to let people know that, they think, okay, I need a plant-based diet, that it's a specific diet, it's a Mediterranean diet, or it's this diet. And they come from all different cultures and backgrounds, and every culture and ethnicity has their version of a plant-based diet. It doesn't have to be onerous or something that it can fit into their lifestyle, and their eating habits and the foods that they like. And like you said, I think it's important to talk to a nutritionist to find out how these diets can also work around their other medical conditions. Say they have colitis or something else like that, and they can't eat so many greens or something. It's important to just become aware of it and realize that there's options that, RWJ Somerset, the whole system has, and resources for the patients that we have. That they can.
RWJ has an excellent dietary area where you can sit down with a dietitian, spend an hour or two. They can actually put together a 14-day base meal plan for you, whether it's plant-based diet, whether you're a diabetic. And they really do help reduce the risk of problems for the people. And again, this is a lifestyle change. It's not something you're doing for 2 weeks. It's something you're doing for the rest of your life to reduce your risk of problems down the road. And you don't want it onerous. You want the person to be able to do this every day and not say, oh my God, I have to do this today. You want them to say, oh, it's perfectly fine. This is what we're doing today.
Right. And it's important to realize that these plans can be tweaked. It's not like a one and done. It is a journey. It is a marathon, not a sprint. And like you said, eventually the goal is to make this a habit. So it's not even something that you think about. It's just something that's incorporated into your lifestyle. And I always tell patients too that the final common pathway that causes problems in the body is inflammation. And all of these lifestyle habits are geared toward being anti-inflammatory. So that's why it's not only good, these lifestyle modifications not only prevent breast cancer and gynecologic cancers, but prevents heart disease and stroke, right? Where inflammation is also the common final pathway of destruction, for lack of a better word. Inflammation chronically causes cells to go awry, DNA to get damaged, and that becomes the nidus of how cancers form, and I guess how heart disease and stroke develops as well in the arteries and the veins and vessels.
The other thing that patients are very worried about is when they get that diagnosis of cancer, either gynecologic cancer or breast cancer, what do they do? And the nice thing is that as you are being part of Steeplechase Cancer Center, you have a nurse navigator that helps them through the whole process. And down at RWJ University Hospital, New Brunswick, as well as the Rutgers Cancer Institute, we also have that. So you've got someone who basically can help get you through the healthcare system. The healthcare system is very difficult, for the average layperson. But if you've got the person there to help you through it, it will get you through it. So do you want to talk about the nurse navigators?
Yeah, Dr. Stevenson, or do you want me to say anything? I think our nurse navigation program is excellent. We've got navigators for each cancer tumor type. We've got a breast navigator, we've got a gynecologic oncology navigator. And I refer to our navigator as that knot in a bow tie. This is what I tell patients, on one side of the bow tie, you've got team patient. On the other side of the bow tie, you've got team steeplechase or team RWJ. That navigator is the person that holds the two sides of that bow tie together and helps the patient get through the system, all the testing, all the imaging, all the doctor's appointments, anything I tell the patients that they need, they can call our navigator. I mean, whether it's financial, whether it's psychosocial, whether it's anything, the navigator is there to help them get through their entire treatment. And they meet these navigators right at the time of their diagnosis. So they're involved from day one with their care. And we have a whole team, both at CINJ and Steeplechase.
I couldn't agree more. The navigators hold us together. They are an amazing resource for our patients. The system is overwhelming. Our G1 oncology nurse navigator, does an intake before I even see them in the office. They help them through pre-op, testing, surgical instructions. So they're an amazing resource for our patients, as the system can be very overwhelming.
Well, as you know, the system is very overwhelming. I've been doing this for 35 years, and it used to be that they'd see an OBGYN here, then they'd see an oncologist here, then they'd see the radiologist here, then they'd see this here. And once you hear that word cancer, you don't hear half of what happens afterwards. And you need that person who's got your back. You need that person who's going to say, I've got these appointments set up for you, and this is where you're going, this is where you're going, this is where you're going, and that this is being done in the right order. I need the person to have social service involved also, because you're going to need help doing certain things. You may need some post-op medications, post-op care, and I've got that person there who's got your back.
Yeah, our nurse navigator also does our pre-surgical training when you talk about post-op care and things like that, where they literally have a one-on-one class with the patients before their surgery, where they go through everything from, soup to nuts to bolts, where to park your car on the day of surgery, where you're going to go, what's going to happen before you get in, when you get in, after you get in. With our patients some of them who need drains, if they need a drain, our nurse navigator has a drain. So during this pre-surgical class, they literally teach the patients how to use the drain afterwards. And so it takes away some of the intimidation. It takes away some of the fear of the unknown with these classes that we offer here, which is unique to our system too, offering these pre-surgical classes.
And of course, the other thing unique to both RWJ at University Hospital, Rutgers Cancer Institute, Steeplechase Cancer Center, as well as all of the rest of the RWJ network, is clinical trials. Can you tell us just a little bit about clinical trials? Who's candidates for it?
I think we have phase 1 through 3 clinical trials available at the Cancer Institute and at our partner sites. And we have system-wide tumor boards and meetings regarding our clinical trials to make sure that they're available to all of the patients across the system. In general, clinical trials initially were designed for people that have failed standard therapies, but we do have a fair amount of upfront trials, palliative care trials, radiation trials, which Dr. Liu, I'm sure, can speak to, surgical trials that are available in the upfront setting. But often these are patients who have failed standard therapy, have recurred, and have very limited treatment options left, and they're able to get access to a drug that hasn't been FDA approved, and hopefully they do very well. So they're available across the system. We partner with our G1 oncology colleagues up at Newark, and my division is 5 G1 oncologists, and we currently cover Somerset, Hamilton, and New Brunswick, for which all of our trials are available.
Yeah, I think it's important to know that not only are trials available when you fail treatment, and we do have special trials for that patient population, but there are trials available to new cancers that are FDA-approved drugs, but being used for different reasons. So if you qualify for some of these trials, breast trials in particular too, you get access to certain types of treatment that are not available anywhere else yet because they're not standard of care yet. For example, vaccines, we are using vaccines for treatment of, early but locally advanced stage breast cancer that's not metastatic yet, not spread. where vaccines are not normally part of standard of care treatment, but women can qualify if they participate in these trials. Special radiation protocols before surgery. Most of the time we give radiation in breast cancer after surgery. Now we're starting to give radiation before surgery in certain circumstances. But women have access to these trials, and because we're part of CINJ, and the reach of an NCI designated cancer center extends to like 11, 12 hospitals. Patients can stay in their home base and still get access to some of these trials sometimes, but sometimes they may have to go to New Brunswick, but a lot of times they can stay at their home base and get, treatment that's only offered at a handful of hospitals in the country, let alone New Jersey. And so I think it's important to realize that they have access through our system, through CINJ. And I think the system makes a very good effort to make sure that patients can be treated at their home base, whether it's Newark, whether it's Claremont, whether it's Somerset. And I think that's important to know.
It's important because this way the patient also has the family afterwards. After they've gotten treatment, they can go home immediately. They're not stuck if they end up somewhere else in the country, staying in a hotel or something afterwards. They're at home. And there's nothing in the world like being at home and with family. It's just like at both Steeplechase and at the Rutgers Cancer Institute, you guys have the tumor boards where you put together every specialist to go over each one of these, and that's when you can make that decision whether the person is favorable for a clinical trial. It's something that when I tell people they go to Steeplechase or they go to the Rutgers Cancer Institute and their case is discussed in front of a tumor board with 20 different physicians there, they say, wow, I can't believe my case is going to be discussed that way, because they get the best of care. They get the best of care locally. They've got the family. They've got the nurse navigator who's helping them through the system. They've got the social service if necessary. They've got everything within their grasp that's close to home. And again, being treated at home is much nicer than being treated 1,000 miles away.
Yeah, I definitely think the collaboration. So when you go to a cancer center, I think patients don't always realize it's one-stop shop for them. Everybody is located at that site. They don't have to go anywhere else. They can get everything from the start to the end of their treatment right here in one spot. All their doctors collaborate. All their doctors, work together to give them the best outcome. And the studies have shown that cancer centers, that's what they provide patients, that the centralized collaborative teamwork effort gives optimal outcomes for patients with cancer. And that's why, our system with our cancer centers is special and unique, and patients get the best care right here in their home.
Yeah, they have access to, oncologic specialists across every disease site, right? And every, I tell people it's like getting 3 or 4 different opinions when we present your case at our tumor board. I'm presenting it to my partners, to radiation oncologists, radiologists, pathologists. Everything's reviewed here. It is, this is why we're an NCI designated cancer center, because this is what we provide our patients.
Yeah, every single breast case gets presented. We just came out of conference this morning. That's what we do. We present all the cases, and we actually assess these cases for clinical trial at the time of presentation as well. Correct. So that and then all of the input from the conference recommendations, I take back to the patients as well. It helps them make their decisions for treatment, lets them know all their options, because sometimes there is more than one option available to them. And, they need to know all their options to make their final decision. And, we're here to give them everything that they need.
And then that's also communicated to their primary care physician also. Thank you both for being here, and thank you both for everything you do for RWJBarnabas Health System. Thank you, Dr. Liu, for what you've done, magnificent work over at the Steeplechase Cancer Center. Thank you, Dr. Stevenson, for everything that you do for RWJ University Hospital, New Brunswick, and the Rutgers Cancer Institute.
Thank you, Dr. Oshinsky.
Thank you for having me. Take care.
That concludes today's episode of Health Talk. Please remember that the opinions expressed here today by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call 844-CANCER-NJ. For more information about RWJBarnabas Health's cancer services, visit us at www.rwjbh.org/beat cancer.